for lunch. Start off with TMJ and the mandible. Remember we said there was two ways to adjust a mandible. You can either pull or push.
This other side. Just something out of the way of the sign.
The segmental contact point was interalveolar space, which meant nothing more than the place in the mouth that's got the teeth. So that's the segmental contact point. You can use whatever hand that you want to, it doesn't matter. And your other hand is going to stabilize over the maxilla above the soft spot of the nose. So you want to make sure that you're on bone with your stabilization hand. Otherwise, you're going to restrict their breathing, which you don't want to do. So again, it doesn't matter which hand, as long as you correct your stance to get the correct LOC. So you see how we talked about how we're naturally right-handed adjusters, and Jim automatically assumes that right-hand adjusting, which I would have done the same thing. But you could use, so just go ahead and switch and use your left hand. As your, yeah, I know. So you can use either one, but just notice how he adjusted his stance. I did that just to show the difference. How he adjusts his stance to still maintain the correct LOC no matter what hand he uses. Okay, and so that's one way you can do it is a pull. The other way you can do it is a push, and the setup is the same except your LOC now becomes a push instead of a pull. Everything is the same. Question? Any questions on
So
those?
if you're pulling from where you're standing now, if you did a pull, you're actually correcting left or right?
You're correcting the mandible, but it affects.
Whole man.
Yeah, it affects actually the opposite TMJ. And the way that I remember it is just if you stick your jaw to one side or the other, feel what TMJ you feel it in, and that'll kind of tell you.
So now, if I was on this side and doing a pull move, it would be for a right lateral mandible.
So it's more of a whole mandible being out versus.
Yeah. Okay. Yes, and the reason that is, remember I said when we talk about the technique that a float won't always correct the TMJ issue, you still have to look at the TMJs. I have seen them where not only, let me back up instead, my brain's going faster than my mouth can catch up, yeah, or vice versa. Yeah. We talked about yesterday how there's combinations of adjustments, and a lot of times it's not always, strictly an atlas posterior, there are things involved. Same way with this. Although we talk about correcting a lateral mandible, it does affect the opposite TMJ. So sometimes you also have to correct the TMJ directly, as well as correcting the mandibular deviation. Okay, so this will correct the mandible. We also talk about TMJ listings. So you may also have a lateral TMJ. In this case, it would be a left TMJ. So if you get a listing of a left TMJ, it looks like that. The segmental contact point is that below the condylar process. If you just find the joint and just come right below it, there's a nice little ridge right there that fits perfectly right in your little V-trough. Okay, it's one of those things that God just did a great job for us in making them that way to make it fit.
It's right on the condylar process, right below the zygomatic arch.
Again, it's a perfect fit. You can't hardly miss. The elbow, the arm's perpendicular to the ground. The LOC is lateral to medial, so it's straight across. And you want to stabilize on the opposite side on the zygomatic arch. So you're going to reach under and stabilize right there. You guys okay with that?
Yeah.
And again, sometimes you may have to correct both of those. Any questions on TMJ? Fairly straightforward, yes.
Those go together a lot of times, the lateral.
They can go together. The hard thing is we don't want to cookbook it for you because a lot of times they don't read the book and they don't know what they're supposed to do. So they don't react that way. But don't be surprised if you do find them together.
Were you asking, is it going to be on the same side though? Is that what you're asking?
I have seen them on the same side. Again, sometimes it should be the opposite side because when you do that, but they don't read the book, and so it's like, oh, I didn't know it was the opposite side, so I made them up. A lot of times, you see diagonal leg involvement, but not always. Sometimes you see it on the same side, same type of deal. Any other questions on TMJ? Okay, so the occiput was next. Remember we said that a couple of things about the occiput. The main thing is that you need stabilization. You have to have stabilization with this one. We talked about if it's called for, you have to do it. If it's not called for and you want to do it, it's okay, you still can. This is called for. The other important thing is the angle of the correction is 70 to 75 degrees from the slope of the forehead to the arm, the segmental contact arm. Your segmental contact point, there's a long explanation in your book, and we said the easy way to remember it is, you just kind of go up in the forelock there, find the bump in the middle of the EOP, and go just lateral to it. There's a little divot in there that fits perfectly on your fleshy pisiform. Another one of those things guys did a good job with. So your angle is going to be that 70 degrees, and you're also going to aim toward the opposite tuberosacral. The stabilization is, as you saw Dr. Parrish, stabilized on the atlas with his inferior hand. And the idea was to try to get that angle, stabilized along the same angle as the doctor's going to adjust.
This is a left occiput?
Yes. That was a left occiput, correct. Also, don't forget too that you can't just tell whoever's there, just stabilize in this. I mean, I tell my wife that, but she knows. Stabilize over here for me. You got to tell them, I want you to take this hand and put it right here. Put one foot behind the other, bend your head. You have to give them exact instructions as far as what you want them to do.
And the person stabilizing needs to be as close to the horse's body as you can. So you want to try and get him within this line of correction, okay? So he needs to be really snug up against the horse's side, okay? Probably the adjuster.
Usually there's only two people. I would suggest to you as a side note, not to go to a barn by yourself,
Yeah.
please. I mean, it's more than a suggestion. It's like, don't do it. It's not worth it. If something happens to you or something happens to the horse and you're there alone, you're SOL. I mean, I have had...
A space occupying lesion.
You're sure out of luck. There's stuff that accidents happen, stuff happens, and we don't want you to be one of those accidents. So please do not go to a barn by yourself. There should be at least two people, and in this case, it's going to be the adjuster that's holding the lead rope. Okay?
So what we would do as the adjuster would just have this in our hand and hold him down here at the bottom just like that. Okay, and then if he was to jump back, I've got some deep.
It'll uncoil out of his hand, not around his hand. You're not stepping on it.
And don't do that.
Holders are notorious for leaving the lead ropes dragging. I'll tell you how many times we step on them, just pick it up, whatever. So that's an occiput. Any questions on the occiput? Okay, so the next one we talked about was the atlas superior, right or left. So since we did a left occiput, Jim will set up for a right superior atlas right superior. Now you don't really need stabilization on this. The segmental contact point is the wing of the atlas, right lateral to the ear. And the LOC is the same. You still got that same angle between the face and the adjusting arm, and you still want to aim toward the opposite tuberosacrally. So it's pretty much the same as the occiput, tuberococcyx, sorry. It's the same as the occiput listing, except now he's set up lateral to the ear instead of medial to the ear. Again, you want a fencer stance. You may need a bail. Crunchy's real good about putting his head down, but more than likely you're going to need a bail to stand on. A lot of times you go to set up and they got their head dropped, and then you sit up and then it's up here. Any question? I'm sorry.
Rarely sees.
Yeah. Yes, that's crunchy. Any questions on atlas superior, right or left?
Can you remind us what they would have trouble doing if they had an atlas superior and right or left? Would they
Yes.
have trouble lateral moving?
They will not be able to tuck the jaw, okay, and follow the face, so right lead canter, tuck the jaw, should follow the face, so what they'll typically do, and it's the same thing for an occiput superior, right or left, is to compensate for this lack of lateral flexion, they'll tend to tip the nose to the outside, and they'll lead with the inside ear, and oftentimes that'll cause them to drop the inside shoulder.
And you will hear almost exactly that when they bring the horse to you. Tell me what's going on with your horse, and I'll say exactly what you just said. He's holding his head to the outside when he goes this way, he's got his shoulder dropped, and you're going, oh, okay. Remember I tell you guys, 80% of your diagnosis comes from your consultation. A lot of times they'll give you the listing if you just listen to them.
Or if you want to dazzle them with your brilliance, if they don't mention this, this is what he's doing, okay? This is what he should be doing, and this is what he's doing because he's not flexing his pole like he should.
They should look really smart. Really nice. It impresses clients. Any questions on the right or left superior atlas? Okay, we talked about atlas superior and atlas inferior, where your reference point is the anterior tubercle. That whole atlas has stuck either superiorly or inferiorly. If you had an atlas superior, it means that the anterior tubercle has moved superior. So in order to correct it, you want to move it inferior. So it's a bilateral contact on the wings of the atlas, and it's an inferior rotation of that atlas that way.
And if you come down toward the bottom part of the wing of the atlas, then you can kind of, you have a little bit more to drive with, okay, a little bit better contact, and it'll help that rotation more, okay?
So if it's an inferior atlas, inferior then means the anterior tubercle is inferior. You want to pick it up superiorly, so your thrust is actually just the opposite.
So come up toward the top of the wing, and now you can do this easier than if you were here in the middle. Come up here on the top, it just kind of helps that rotational component.
Again, remember obviously the chin is on the shoulder. Doesn't matter which side you stand on, but it is a bilateral adjustment. It is on both sides. And also, if you notice that one of the first things he did was move the the lead rope from the chin ring to the cheek ring. So
And put it on the opposite side, not here.
you don't want hitting in the face either. So in case he should get excited and drop his head, it's not going to kill your clavicle.
I think they need to move.
Okay, any questions on those two? So the next one we talked about was an atlas posterior, right or left. Your segmental contact point is the dorsal arch of the atlas on the side of the listing. So if it's an atlas, if it's an atlas right posterior, it's going to contact the right dorsal arch, and he's going to put the heel of his hand on the dorsal arch. Notice that the chin goes on his left shoulder, his left hand goes down first, his right hand goes on top of it. He slightly extends the head, and the LOC he's going to pull towards his external notch. We talked about how you need to slightly extend the head. Don't worry if the horse, sometimes he'll rotate it one way or the other. Don't worry too much about that. The main thing is to get the extension in that neck to get that joint detention.
And get that heel of the hand right on top of that wing, which puts you on the dorsal arch. But get on top of that wing of the atlas, kind of right in here on the heel of the hand, like that, and then lock it down with the other one, okay? And this is one of the very few moves where when you do it, if it's really stuck, that you will really feel this kind of a thump when it moves in. And sometimes I'll just step back for a second, and that horse will do this and everything else. So I mean, it's a big release for them.
Sometimes they just kind of look around like, wow, what was that? And you go, well, we just kind of took his headache away. And they say, really? And I go, yeah, because a lot of times with people at subluxation is there, we get headaches too, and I have to believe that they do the same thing. So he's probably had a headache for some time. Those are really common. Again, remember we said do not interlock your fingers because you can go for a ride.
Yeah, I can get things.
Yeah, it can get dangerous. Obviously, you don't want to do those moves with them tied up or in cross ties. A lot of people, you go to English barns especially, will automatically cross tie them for you. You know, when you get to adjust them, just tell them, just please take them out of cross ties and hold on to them.
And also on this atlas posterior right or left, this one, they can react one of a number of ways. Sometimes they'll jump back, so you need to alert your handler. And I usually have the handler over here so that if the horse jumps away, I don't get tangled up in the lead rope. I don't want the lead rope kind of coming around me. I want it off to the side so if the horse reacts backwards, I'm not getting tangled up in it. The other common reaction to that is I couldn't tell you how many times I've been chest bumped. You know, you'll do it and you'll come down, and it's a forceful move. So you come down, and as you're coming up, he's coming forward. So get a real good stable stance. When you do this, do not get like this to do it because he'll knock you on your butt. Okay. So, and then other times they'll just kind of stand there. But the three most common ways is him standing here, or him running back, or him running forward. Okay? So just be aware of that. Okay?
Any questions on atlas posterior right or left? Don't forget, you can see those in combination. You can see an occiput with an atlas and one of those vectors, listings.
You typically, not all the time, but I find a lot of times if I've got a horse that will not tuck his jaw to the right, he can have an atlas superior on the right, but a lot of times I'll find an atlas posterior on the left. Okay, so just be aware of that.
There's a chiropractic school of technique that says every time you have a TMJ problem, you also have an atlas issue. I know you've heard me say already, I hardly ever say never or always. And so I personally just don't like it when I say you always, because I don't think you always do. That's just me. But be aware that if you're going to adjust, if you adjust a TMJ or you adjust an atlas, make sure you check the other one too, because they will happen a lot in conjunction with each other.
Do you guys usually check the TMJ last or the jaw last, or do you?
I think we all have our own ways of doing it, and basically, you know, we tell you, and I'll tell you, I don't care what your routine is, just develop a routine and keep it the same way all the time. You can start and finish wherever you like. I think I probably do my TMJs last, close to last. But that's strictly a factor of the way I was taught. When I went through the program at Options, you could start in any module as long as you did the whole thing. I happened to start with thoracolumbar. And so I start with thoracolumbar, go back into the pelvis, because that was the order in which I took the modules.
And I start here.
Yeah, so it doesn't really matter. Any other questions about anything TMJ, occiput, atlas?
It's a good idea to develop a routine, okay? Wherever you decide to start, get in the habit of starting. It doesn't necessarily have to be the same side every time, but at least have a starting point, because inevitably, especially with an owner, they're gonna start asking questions, and if you're jumping around, you're gonna forget, you know, where was I, you know? And so for me, starting here at the head, working my way back, I can carry on a conversation while I'm working on the horse, okay? And so it's just a good idea early on to develop a routine and then stay with that routine. Find the one that works best for you and then go from there. And then stick with it. And it helps a lot.
For me, that's multitasking. I mean, I can talk to them and adjust. But it's something that I can't do three things at once. I can do two. I can talk to you and adjust, but I can't do three. So, but exactly, they will ask you questions and stuff. Usually what I tell them so that I don't get out of my order is I'll answer that. I'll answer that when I finish. or ask me again when I'm done, and I'll tell you. And I say, I'd rather give you, let me wait until I'm done, until I tell you what I find, so I can give you the whole story instead of pieces at a time. It makes more sense if I give you the whole picture. That's what I tell them. Okay, so the next one will be a posterior C2, just like we did the posterior listings in the dog. We just talked about, however, the horse C2, because you can't really get to anything more caudal than that because of the crest and nuchal ligament and all the soft tissue. So again, it doesn't matter which side you stand on. The chin's going to go on your shoulder. The lead rope's going to go on the cheek ring, and you're going to contact the posterior aspect of C2. Again, you're going to slightly laterally extend the head, and the LOC is toward your external notch. The important thing here again is at the end there's a scoop. There's a little scoop at the end because of the concave-convex relationship in the facets between 1 and 2. You have to show us, if we say, show me your LOC in the air, show me your adjustment in the air, you got to put that scoop in. It's that important. Again, don't interlock your fingers.
Show more and say less.
And you may find that in combination also with an atlas or an occiput listing, civilization. Any questions on those? They kind of do the same thing on that too. Sometimes they'll, they'll just kind of look at you. Was it pretty straightforward?
How are you going to determine that that needs to be?
You're going to get sick of me saying it. Motion the same way you're going to adjust.
But there's not like a complaint.
Presentation for it. They won't break it to pole. It's fairly common. Remember the pole really consists of occiput, atlas, and axis. It's a three-segment complex. So usually some kind of pole complaint.
Lack of extension.
Sometimes they're difficult to bridle. They don't want to be haltered or bridled. You guys, anything you guys see commonly with posterior C2? And any complaints that you commonly hear with posterior C2? Or with signs and symptoms?
Background.
Yeah, I think it's bilateral, right, left lateral flexion limitation.
Okay.
Or resistance.
Bilateral.
Resistance to flex.
Flex and come around.
So he will
Resistance to flex and come around.
always nose out.
Yeah, you get that limited in both.
Any other questions? Okay, so C3, 4, and 5 are next. Remember, those are body rotation listings. So whenever we have a listing, we have to have a reference point. Reference point in the cervical, in the mid-cervicals is the body. So it's body rotation, body right, body left. So this will be a setup for a body right. Remember, because of those joint plane angles, 45, 45, this is where it comes into play. I know Dr. G, as we talked about, starts kind of perpendicular and then gets to the 45. I start from the same plane and come out to 45. It doesn't matter. You just want to come out 45 and up 45. So his elbow is out 45 and up 45. He's got a hold of the halter, bring the neck around, laterally flex it till you bring the joint to tension, and then his LOC is just going to follow his hand forward. It's not a karate chop in. Okay, you're not doing that. You're doing that. Remember where the LOC comes from with a one-handed throw?